Removable appliances are those orthodontic appliances that are inserted into and removed from the oral cavity by the patient at will. This consists of three major components. First, the active components, which includes bows, springs, retractors, elastics, and screws. Then there are retentive components, which includes various kind of clasps. And then there is base plate, which connects all the remaining components into a single functional unit. Advantages of removable appliances. They help to maintain good oral hygiene because they can be removed from the mouth and cleaned separately. Less chairside time as they are fabricated in the labs. Damaged appliance can be removed by the patients, thus preventing any oral traumas. Simple to fabricate, use and adjust. Hence, they require less chairside time. Less orthodontic scars. Orthodontic scars are any adverse effects of orthodontic treatment, including soft tissue or hard tissue injury or white spot lesions. Cost effective, efficient for use in certain kind of orthodontic movement. First choice in the first stage of correction of posterior crossbite, commonly used in mixed dentition for interceptive procedures. Now moving on to disadvantages of removable appliances. They are not effective with uncooperative patients because if the patient is not willing to wear the appliance, they can't be effective. Only treat minor cases of malocclusion. Only capable of tipping type of tooth movement. Limited control over the tooth movement. Tooth movement in three-dimensional is not possible, may hinder with speech and eating. Appliances may be lost or broken. Residual monomer of the acrylic resin may cause allergy or irritation. Retentive components. Now, retentive components are those components of the removable appliances that help to keep the appliance in place and resist its dislodgement. Clasps are the wire components that aid in retention. They act by engaging restricted areas of tooth known as undercuts. Now, these undercuts are of two types. They can be either mesial or distal proximal undercuts or buccal or lingual cervical undercuts. The mesial or distal proximal undercuts are more pronounced, hence more retention. So, the clasps engaging in these regions are Adams Clasp and Crochet Clasp. The buccal and lingual cervical undercuts only are present in fully erupted teeth. Hence, the clasp engaging these areas are the C-Clasp and J-Clasp, and this doesn't offer much retention as in the cases of the clasp engaging in the proximal undercuts. Requirements of a clasp. Should offer adequate retention. Should permit usage in fully and partially erupted teeth. Should give adequate retention even in the shallow undercuts. Should not give active forces, that is, the clasp should be passive. It should not bring about any undesirable tooth movements. Should be easy to fabricate. Should not impinge on soft tissues. Should not interfere with normal occlusion. Circumferential clasp, C-clasp or the three-quarter clasp. So, this is a clasp which engages the buccocervical undercut. So, it is engaged from one proximal undercut along the cervical margin of the tooth, then carried over the occlusal surface of the tooth into the palatal aspect and ends as a retentive arm in the palatal aspect, which is embedded in the acrylic plate. The advantages of the C-clasp is simplicity of its design and fabrication. The disadvantage is it cannot be used in partially erupted teeth. Jackson's clasp or the J-clasp. Now, this is also known as U-clasp or full clasp. It was introduced by Jackson in 1906. It engages the buccocervical undercut and also mesial and distal proximal undercut because it's a full clasp, so it engages all the four undercuts. Advantages? Again, it's simple to construct, offers adequate retention. And the disadvantage here is it offers inadequate retention when used on partially erupted teeth. Adams Clasp, an important clasp in orthodontics. It was given by Philip Adams, also known as Liverpool clasp, universal clasp or modified arrowhead clasp. It is constructed using 0.7 mm hard round stainless steel wire. Parts of the clasp include two arrowhead which are connected by a bridge and the arrowhead end as two retentive arms. The advantage of Adams clasp include It is rigid and offers excellent retention. It can be fabricated on deciduous as well as permanent teeth. It can be used on partially as well as fully erupted teeth. It can be used on molars, premolars, and on incisors. No specialized instrument is needed for its fabrication. Small and occupies minimum space. Clasp can be modified in a number of ways. Now moving on to the modifications of Adams clasp. The first one, Adams with single arrowhead. So this is used in partially erupted teeth, usually the last erupted molars. Second one, Adams with J-hook. Here a J-hook is soldered onto the bridge of the Adams clasp. This helps to engage elastics. Adams with incorporated helix. Here again a helix is incorporated into the bridge of the conventional Adams clasp. This helps to engage elastics. Adams with additional arrowhead. So here additional arrowhead which engages the proximal undercut of the adjacent teeth and is soldered to the bridge of the conventional Adams clasp. This helps in giving additional retention. Adams with soldered buccal tube. So here a buccal tube is soldered to the bridge of the conventional Adams clasp. This permits extraoral anchorage using through the face bow headgear assembly. Adams with distal extension. Distal arrowhead has small extension incorporated distally. So it will be going distal from the distal arrowhead of the teeth towards the next molar. So this arrowhead can be used for engaging elastics. Adams on incisors and premolars. So this is used when retention is needed in those areas. This Adams clasp can be used to span single or two teeth. Southern clasp. So this is used on incisors made when retention is required in the anterior region. Wire adapted around the cervical margin of both the central incisors and then it falls back to the palatal aspect. Triangular clasp. This is triangular in shape and is used in the posterior region. Engage the proximal undercut of two adjacent posterior teeth. It is indicated when additional retention is needed, that is, it is used with other clasp as well. Ball clasp. Made in stainless steel wire with a knob or a bowl-like structure at one end. The bowl is made up of silver solder. Bowl end engages proximal undercut of two adjacent teeth. So this is again used in additional retention, that is along with other clasps. Distal end of the wire is curved to the palatal aspect as the retentive arm. Schwartz clasp. Now this is also known as the arrowhead clasp. This is the predecessor of the Adams clasp. It has an arrowhead that engages interproximal undercut between the molars and the premolar. Disadvantage of Schwartz clasp. It needs a special arrowhead forming pliers to fabricate, occupies large amount of space in the buccal vestibule. Arrowhead can damage the interdental soft tissue, difficult in and time consuming to fabricate, hence it is not used as common as the Adams clasp. Crochet clasp. It resembles full clasp but has additional wire soldered onto the mesial and distal proximal undercut. These additional wires, they offer extra retention. That is, it is better retentive than the normal full clasp.
Download Blulines now, redefining quality education.